Hello YouTube, let's talk mental health and medical care. Now, if you have a known diagnosis of a psychiatric disorder, anxiety, bipolar, schizophrenia, OCD, etc., you may have found a inbuilt stigma with certain practitioners. The minute that a psych history comes up, or is known, or worse or still has been witnessed during an episode of decompensation or an illness, that your practitioner thinks about you differently. They may actually interact with you differently. I've had experiences where my primary constantly comments, regardless of the reason why I'm there, about, well, you're so calm this time, and tells his nursing assistant, I've seen her bouncing off the walls and really out of it, as a running dialogue about my mood due to my bipolar, because he's seen me during my psychotic episode. It's constantly the lens through which I am viewed, and because it is the lens through which I am viewed, it's the lens through which I am treated. Having those type of experiences tells you may need to switch doctors if they begin to treat you clearly, obviously, through the lens of a psychiatric disorder. It can also be a little less obvious, a little more insidious than that. I have neurological disorders, migraines, and small tumors in my brain. And I had a aneurysm disorder that shunted blood away from my heart, causing me to faint. All of these reasons led me to neurology with a variety of symptoms. And I went through many years in and out of neurology with them running the tests and telling me that everything was fine. And I was labeled somatization. Somatization, if you are unfamiliar, is when a person, usually below the age of 30, has a cluster of unexplained, medically diagnosed symptoms and medical complaints. It is a conversion disorder where they assume that you are converting your anxiety into hysterical physical symptoms that have no medical basis. And as soon as that was put on my chart, because they couldn't find the answer, and because I have a psych history, up until it was stumbled upon, my aneurysm was stumbled upon in another test and corrected, and the fainting thus corrected, and the tingling and the numbness thus corrected, and the CAT scan began to show something until there was documentation. Everything I brought up, even the migraine, was knocked off to anxiety, was knocked off to conversion, was knocked off to dismissed as being in my own mind. So if you have a psychiatric disorder, you have to be wary of advocating for yourself to get proper physical care for physical conditions. You have to be your own advocate. You know yourself the best. If there is something medically wrong with your body, don't just automatically take a write-off because you have a mental illness. Be willing to fight for yourself. Be willing to write complaints. Be willing to change practitioners. And if you cannot fight for yourself, there are medical advocates in the medical field and in the mental health field that you may be able to find to help you help yourself. Don't be afraid to switch practitioners or get second, third, fourth, fifth opinions. Don't give up, don't stop. When it comes to your physical health, it can be more difficult to get proper care, proper diagnostic testing, proper treatment, proper belief through unconscious, unintentional bias from physicians. If something is not immediately clear diagnostically obvious, the next answer may be that it's just in your head. Don't allow yourself to be boxed in as simply neurotic. You have to fight for yourself. It's your health we're talking about. The most important thing you have. For your entire life. Don't let your health get overlooked or dismissed because of a pre-existing diagnosis. Keep on fighting for yourself. It's critical. And it's a critical skill to build because it may be an issue you confront periodically throughout the rest of your life. They don't do it on purpose, not all of them. But once it's on your paper, that label is hard to see past. It's up to you to have the fortitude to continue to fight for your medical rights and your physical health. Be your own advocate. And if you can't, find one. Love you guys. Bye, YouTube.